The risks for colon surgery are pretty standard, and I usually tell all my patients the same risks. Anytime you cut the skin, there's going to be a risk of pain, bleeding, and infection. If I can do the surgery laparoscopically, I usually infuse or give local anesthesia or numbing medicine to the areas of incisions, and then there's some pain medicine afterwards. It's usually not too bad from that. Open surgery is going to be a little bit different. The pain requirements are going to be a little bit different. Anytime you cut the skin, there's going to be a risk of bleeding. I usually always tell patients that there may be a little bit of oozing on their dressings afterwards. Within the abdominal cavity, when operating on the colon, there are some large blood vessels that go to the colon, so there's always a risk of having some blood loss, but rarely is a blood transfusion ever needed. Then the risks of infection. Because the colon is not a clean organ, as you cut across it, there's always a risk of getting an infection in the abdominal cavity, but we irrigate afterwards and try to clean out the abdomen quite well to make sure we don't get an infection, or at least decrease the risk of infection. The main risk for doing colon surgery, though, is anytime you cut a tube, if you think of the colon as, now we'll think of it as a hose, if I cut a piece of that hose out and I want it to work again, I got to put those two pieces back together. Where I put it back together is called an anastomosis. And we always worry that that area that we sew or staple, there's a couple different ways to put it back together, can have a leak or it can break apart. If that happens, it can be a surgical emergency depending on when it happens and the frequency of drainage from that area, but typically we'll be on top of it quite quickly and then take you back to the operating room to fix it. The risk of that is still pretty small, less than 5%. If a leak does happen, it's going to be in a small area and we can usually manage it quite easily.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.